So I'm going to show you how to do kinesiotaping for a carpal tunnel syndrome. This lady has symptoms right here in the first 3 fingers from a car accident. It was there originally in her first finger, but now it's gotten worse to the 3 fingers here. I believe it's originating from here. From here, here's the carpal tunnel nerve, and through here I think it's getting pinched off, and I think there was some pinching here too. And so I did some other therapies, and along with oxygen, and that actually boosted her oxygen levels to almost 100% with the oximeter. But now I'm going to show you how to do a kinesiotape to reduce swelling. Now she's also complaining of swelling because her ring can't fit. So what I do is, you can do a whole long piece like this. That's usually harder to do. So I'm going to just cut it into 3 small pieces. And you want to do probably about a 20 to 30% stretch. I'll explain that to you in a second. So you've got about 3 blocks here, right there, 3 blocks. And I'm going to cut probably 3 blocks, and then as you stretch it about 20%, it'll go up to about right there. So now the next one's going to go right here. Do another 3 blocks, go right to there, and so probably three strips of 3 blocks to make it easy. Okay, so 3 strips of 3 blocks. And so you want to get the good kinesiotape. Don't get cheap versions. I've tried cheap versions from Walmart. They don't last for more than a couple of hours. This, if you do it right, and you take off the any excess oils. So you seem to be pretty dry, so that's okay. So if you take off any excess oils, you may need to do alcohol if you get oily skin. Then it'll last 3 to 4 days. So I'm going to put the first one on. I'm just going to tear it. And in this case, she has swelling. So in that kind of case, you always start the tape higher and pull down this direction. So we're going to start here like this. And the toughest part about this is putting the patient, because the arm is so active. So remember, you start a little bit higher, and then you're going to stretch it down this way. So there's no stretch on when you rip off the piece of tape. No stretch at all. You rub it down. Sorry, heat sensitizes it and makes it stick better, so you never put a hairdryer to it. So now you stretch it about 20%. This is not a rocket science, just stretch it. But don't stretch it too much. So I stretch it about 20% and then lay it down. The last part is not stretched. I just let it lay down like this. And you want to extend the arm. In this case, I probably do extend it backwards like this. Okay. Okay, and then you basically rub it. Now I rub it this way so that I don't get anything to, because once this starts to peel, it'll start to peel. So you want to protect it. Now it's hard on the hand. Excuse me. It's hard on the hand because you use it so much it'll start to peel. If it does start to peel, just kind of like, cut it with a scissors, the end piece. Try to wear it for 3 to 5 days. At the very, 3 days is the minimum that I would like for you to wear it. So we're going to go up this pathway and all the way up to there. Same thing of the next one. Rip at the end. Okay. And then peel it off. And then put it right next to the other one. This one I do to the sides because I don't want to rub this way because I'm afraid to peel the other one. So I'll go to the side like this. Heat activates it. You pull it so that the strip comes off, and then you take the last inch and you extend it. Make sure her arm is not bent like this when you put it on. You got to extend the arm in the direction that she uses the arm, the opposite of the tape. So stretch it a little bit, and then the last part you don't stretch, just the middle part is stretched. Now I like to rub it in the middle really good, and then part this way. So one more. Again, you rip, you pull so that the tape comes off, the backing comes off. And this one, again, you put it right next to, I'm going to do it along the pec muscle here, as close as I can to the pec muscle, which is this muscle, the chest muscle right there. sometimes that chest muscle will pinch the nerve and blood vessel going down the arm, causing that decreased oxygen and pinching of the nerve. Okay, so rub it, and then take the backing off, pull it back, and then this one a little bit different here. I want to have you bring it back this way, because you want to go opposite direction of motion of the tape. Okay. Okay. Okay, so I'm going to tell you this is a wonderful system, because if she has any symptoms in this area right here, if she has any symptoms at all in this area in the arm, right here, for carpal tunnel or anything, what that system right now is designed to decrease fluid or inflammation. And so it helps with multiple different things. You know, if you have swelling, carpal tunnel syndrome, nerve pressure, if you want to decrease any inflammation, this is the direction you want to do it. There's a whole series for kinesiotaping, and you can probably look it up online. But that's what you do. That's what I would do in this situation, because she has pinching in different areas of the arm. So I'll see you next time.